Welcome to the Ataxia Center Educational Series. I'm Elizabeth Tracy. Today I'm speaking with Dr. Kristin Baranano about children with ataxia. Dr. Baranano is a neurologist with the Ataxia Center and the Kennedy Krieger Institute in Baltimore and has particular expertise in the diagnosis and management of children with ataxia and adults with childhood onset of ataxia. Welcome. Thanks for joining me.
Oh, thank you. So happy to be here.
I'd like to start first, if you don't mind, with just a definition of ataxia. I think that's just a little bit of medicalese, maybe hard for some folks to understand.
Sure. So ataxia means incoordination, but not due to muscle weakness. And it's particularly challenging to diagnose in children because it's occurring in the background of developmentally appropriate incoordination.
Help me out a little bit further with that. So I have a grandson. He just started walking. He's a year old. So are you saying that in the background of that, it might be hard to see that there's a problem?
Absolutely, and certainly if it starts slowly or very subtly, it can be challenging to pick up. If you think about very early walkers, they have a very wide base. They're oftentimes described as walking like little drunken sailors. And so if that process is exaggerated or is taking longer to improve than we would expect, then we might consider a diagnosis of ataxia.
Okay, so when should a parent become suspicious that maybe this imbalance they're seeing might be ataxia?
So when we talk about the sudden onset of ataxia, it tends to be pretty dramatic in this situation, and parents are going to notice right away that something is not right with their child. They'll notice that their child is walking like a little drunken sailor when before they had been more steady. You might notice more falls or more clumsiness, and then you might also notice that there are changes, for example, in coordination with using their hands, with reaching for things, or with feeding themselves. Sometimes if the structure called the cerebellum in the brain is involved, we'll also notice there can be slurring of the speech, what we call dysarthria, or there can be abnormal jerking eye movements called nystagmus.
This sounds kind of scary to me. Do parents usually start out with their primary care doc when they're looking at this?
So they may well call their primary care provider if they notice the onset of symptoms, and typically they'll be told to go to the emergency department for evaluation.
In the emergency department, are those folks necessarily up to speed on all of this constellation of symptoms you've described?
Absolutely, because actually the most common cause of ataxia in childhood is actually going to be accidental ingestions. So unfortunately, kids are busy and curious and will get into medications. And so there are many common medications that adults take, like anticonvulsant medications for epilepsy, or even things like antihistamines, or even sometimes alcohol that children can get into and can cause problems.
This sounds like, is there a pretty good prognosis? Because if it's an accidental ingestion, would that be temporary?
So certainly if we can identify with certainty that it's an ingestion, we will always contact poison control and treat appropriately. But if it's not clear immediately that it's an ingestion, then definitely the child will require further evaluation.
Do you mind exploring further then some of the causes that would not be an accidental ingestion?
Sure. So one of the most important things that we can do for a child with sudden onset of ataxia is actually a brain MRI. So a detailed picture of the brain that can exclude a lot of the very worrisome sudden causes of ataxia. These would include things like actually brain tumors and strokes that we sometimes see.
Wow. What age is it typical for a child to present with ataxia?
Well, the most common ultimate diagnosis is something called acute cerebellar ataxia, and that's actually what we call a diagnosis of exclusion. This is when we've done a brain MRI, we've done something called a spinal tap or a lumbar puncture to sample the spinal fluid to make sure there's not evidence of infection or inflammation. But we think of this acute cerebellar ataxia, which typically occurs in toddler-age children, as being the body's reaction to a virus or something like that that cross-reacts with the brain and the spinal cord potentially to produce the symptoms of ataxia.
Now, how about that case? In that case, do things improve? Can they get better?
Absolutely. So with one of these post-viral acute cerebellar ataxia syndromes, we expect kids will be back to themselves within 2 to 3 weeks. And so if a child is not completely back to baseline in 2 to 3 weeks or has recurrence of their ataxia symptoms, this is time when a family really should be seeking out advice from a specialized ataxia Ataxia Center so that we can really come up with a definitive diagnosis and treatment plan.
Now, of course, there is a specialized devoted ataxia center here at Johns Hopkins. How common are such centers nationwide?
So there are a handful of centers spread out throughout the United States, and obviously Hopkins is, we think, an excellent one.
Very good. Talk to me about what it takes to get an appointment here.
So we have a wonderful coordinator who will talk with families or their primary care providers or primary neurologists who call or email to make contact and say that they have a patient with ataxia. She will coordinate getting those records for us to review, and then she has us review the records so that we can prioritize appropriately getting the patient in to be evaluated in the right time frame.
So far, you've been pretty hopeful about ataxia. You've told me that it could be ingestion, it could be something that's following an infection, but maybe not. So are those the kind of patients who typically come here to this ataxia center?
Sure. So when we talk about, we've talked about sudden onset of ataxia, but we also have a subset of kids who have either they're children who start out with some motor delays. They may be just very incoordinated as their motor skills develop. Sometimes they have what's called hypotonia or low tone. Those are children that we oftentimes will evaluate for a potential cause of their ataxia. And then we also have children who are initially developing normally and then develop progressive incoordination. And those are children who definitely need aggressive investigations to understand the cause of their ataxia.
And what can we do about it if we find such a thing?
Well, it depends on the cause. So for example, one of the causes of ataxia we never want to miss in young children is something called opsoclonus myoclonus syndrome. And the reason why it's so important to make that diagnosis is because it can be associated with a certain kind of tumor called a neuroblastoma.
What's the most common age at which ataxia of one of these more permanent or troubling varieties is diagnosed? And are there times when older children, for example, might develop it?
Sure. So the most common genetic cause of ataxia is something called Friedreich ataxia, and that typically has onset before the age of 25.
How about you also take care of adults who still have the sequela or the long-term complications of ataxia?
Sure. We know that there are many people who have onset of their symptoms in childhood, and those symptoms will be stable or potentially progress into adulthood, and that's also a set of patients that we evaluate here at the Ataxia Center.
And what can be done for them?
So in general, the approach towards treatment of ataxia in both children and adults is very similar. The first thing that's most important is to identify a definitive cause, if at all possible, because that really shapes the treatment options. There are some very treatable causes of ataxia that we never want to miss. For example, there's ataxia due to a deficiency in vitamin E. There are a set of ataxias related to deficiency in coenzyme Q10. And there's actually a disorder where there's problems with importing glucose into the central nervous system that can cause ataxia, and that can be treated with a special diet called the ketogenic diet. So these are the things that we never want to miss.
Absolutely. I would think that these call for really prompt evaluation.
Absolutely. And it's always our goal to get these patients in as quickly as possible so that we can help with their evaluations.
So let's talk about treatment and management.
Sure. So again, it comes back to really working towards coming up with the underlying diagnosis. There are certain forms of ataxia that have specific treatments that, even though they don't cure or reverse the ataxia, can really address the symptoms. So for example, we have a number of children who have what's called episodic ataxia, where they have attacks of ataxia. And there are certain medications, including acetazolamide and 4-aminopyridine, that can really help reduce the frequency and severity of their attacks. So we definitely want to make that diagnosis if it's appropriate so they can get on that treatment.
What about physical therapy?
Absolutely. So any child or even adult with ataxia should be evaluated by physical therapists, occupational therapists, and speech-language pathologists who have expertise in ataxia. We know that one of the best interventions for ataxia is actually exercises that challenge our coordination to help strengthen and reinforce those circuits. So we definitely want our children and adults to be engaged in physical therapy programs to help with that. that. We also have interventions. There's something called a balance wear vest that patients can be fitted for and oftentimes benefit from in terms of helping their core stability, and many patients find that device very helpful.
In addition to physical therapy, occupational therapy, are there other types of therapy that might be important, especially as children get older?
Certainly. So we know that many of our children with ataxia will also have learning difficulties, and so we oftentimes will recommend what's called neuropsychological testing to really understand their strengths and weaknesses in terms of how they learn best. And then we can help take those recommendations, incorporate them into school learning plans to help our kids do their very best.
Is there any genetic component to ataxia?
Absolutely. So when we talk about the initial causes of ataxia that we've ruled out, things like strokes and brain tumors and autoimmune disorders like that opsoclonus myoclonus that we talked about, what we're left with when we don't have a diagnosis at that point is it's very likely to be genetic. And so that's the point where we would employ some of this specialized genetic testing to come up with a diagnosis.
And is that also something that a specialized center would be the best place to seek?
Absolutely. We have a genetic counselor who's a very important part of our team in terms of talking with families about genetic testing and helping coordinate that and helping with interpreting results.
In those cases where you've identified a potential genetic cause, are there specific types of ataxia within that group?
Absolutely. So when we talk about genetics, it's important to understand that we have about 20,000 individual genes, which are the individual units of information that cause our bodies to develop and function. And so that a change in a single one of those genes can sometimes produce ataxia, especially if the function of that gene is important in the cerebellum and other parts of the nervous system. Sometimes a genetic change comes about, well, to back up, so we have 2 copies of every gene. And so sometimes if a patient inherits a change from each parent that comes together in them, it causes what's called an autosomal recessive disorder. And so the Friedreich ataxia is an example of such an autosomal recessive disorder.
You described autosomal recessive characteristics. Are there also ones that only one copy of a gene is needed?
Absolutely, and those are called autosomal dominant disorders. And when we talk about ataxias in adulthood, those are actually the more common ones, and they go by names like spinocerebellar ataxia type 1, type 2, and type 3. And so we know that if a parent has a spinocerebellar ataxia like that, each one of their children has a 50% chance of being affected. And some of these disorders do display what's called anticipation, where a child can be more affected at an earlier age than their parents. So those are progressive disorders, but there are autosomal dominant spinocerebellar ataxias that have a more stable course with time, so can have a very different prognosis.
It sounds like maybe it could be hard to actually get a diagnosis if you didn't seek specialized help.
Absolutely. Ataxia individually is a very rare disorder, and so that's why it's so important to come to a specialized center where we do have the expertise and the breadth of experience to recognize the different types of ataxia and put in place a plan to come up with a diagnosis and then also a treatment plan.
And when someone becomes a patient here, they'll be seen for the rest of their life?
Absolutely. We typically, depending on how stable a patient is and how old they are, that'll depend on how often we want to see them back. But typically, an adult might come back to see us every 1 to 2 years. Depending on the age of the child, we might see them more frequently every 3 or 6 months.
Excellent. Thank you so very much for joining me.
Oh, my pleasure. Thank you.